Hey everybody, it's the lit nurse, A-Love, and this time I'm back with another video talking about my first nursing interview. I want to get you guys prepared for your first nursing interview. I got asked 10 questions. I definitely wasn't prepared for it, so I will be discussing the questions and possible answers, or I'll be discussing my answers. And at the end of this video, you'll find out if I got the job or not. So I interviewed at a top teaching hospital in my state for a nurse residency program, and here's what they asked me. We're gonna get right into it because I have 10 questions to go through with you guys. So number one, they asked me, what is my GPA? And I was shocked by this question because I was always told that once you pass your NCLEX, you don't have to worry about, anyone asking you, what was your GPA? That is false. They wanted to make sure that my GPA was above 3.0, and thank God it is a 3.2, and I worked hard, girl, for that. So I was glad about that, and I was able to answer confidently. Number two, they said, name a situation where you acted with intent or focus. How did that impact the outcome of the situation? And although I was kind of stuck here, I just said, I always act with intent and focus with every patient that I interact with. And I said, I always make sure that they are safe and comfortable. I always make an effort to always observe their physical integrity, which can help predict negative outcomes like a decline in patient health. So although they wanted a specific situation, I kind of turned it around and said, I always act with intent and focus with every patient because I know how quickly someone's health can decline in a split second. So this is number three. Talk to me about a time when you spoke up for a safety issue or a time someone had to approach you about a safety issue. And number one, you never want to make yourself look bad. So no one has ever had to approach me about a safety issue. I always follow the protocols in any clinical facility that I'm at. And that's true for me, and I hope that's true for you. So that's number one. And secondly, I have witnessed a safety concern that actually a nurse had. And this is what happened. A doctor, a medical resident, came into the room and he proceeded to examine a patient's new operation wound without gloves. So that obviously put that patient at risk for an infection, and the nurse actually had to talk to that resident afterward about the situation and about possibly exposing that patient and that he shouldn't do that again. And the interviewer actually made it a point that the nurse should have stopped him immediately, not afterward, but immediately, so to prevent, that patient becoming getting exposed to a possible infection. So the interviewers always want to know that you're one step ahead and that you're always being an advocate for the patient. It's always, nursing is about patient advocacy. So it doesn't matter that you're going to embarrass the resident. It doesn't matter that you're going to embarrass a nurse. If they're doing something that's unsafe about a patient, you need to speak up immediately, not afterward, after the patient could have been exposed, And I think that's where I got stuck at it, because you never want to cause a confrontation with someone, or you never want to make someone look bad in front of a patient, but when it comes to safety, you have to stop it immediately. So that's one thing that the interviewer made a point. So if you say that on your interview, that you don't care, about that you're gonna always be a patient advocate first, you got the job, basically. They want to hear that. I don't know if you got the job, but they want to hear that. So number four was, what if you saw something unsafe? Would you feel comfortable approaching a coworker about unsafe practices? And that's basically just what I said. They want to hear that you feel totally comfortable being a patient advocate and telling a coworker or whoever it is, hey, this is an unsafe practice, but communicate in a way that's obviously not confrontational, but you need to be a patient advocate first. And say yes to this question. You want to say yes. I am a good communicator, so I have no problem telling a coworker that, hey, that's not safe, or hey, did you forget to wash your hands, or things like that. They want to hear that. Number 5, tell me about a time you had a patient concern. What was it about, and what was your role in resolving it? So I talked about a time that I was actually a nursing student and a patient's blood pressure was really low. And besides the patient's blood pressure being really low, the patient just looked out of it. So I measured the blood pressure in the right arm. It was low, like I believe below 90/60. I measured the patient's left arm. It was still low. So I immediately told the nurse, and that led to a chain reaction. The nurse re-examined the patient, and that actually led to the rapid response team being called in the hospital because they could not get the patient's blood pressure up even after the patient had fluids. So it ended up being a real emergency that was a life-saving measure for me to, you know, identify this and immediately notify the nurse. And it's just about being attentive. You know, you want to make sure you give an example that shows that you're attentive to details. You can recognize an emergency, and you can recognize patient deterioration. So, and I also made the mistake of saying, oh, I had the small little role of telling the nurse that the blood pressure was low. Don't say that, because they don't want to hear you say that any role in the hospital is small. And I don't know why I said that, because that's not even something I believe. I believe everybody, from the janitor to the head doctor to the chairman to the charge nurse to the nurses on the floor to the medical residents walking around the hospital, are all crucial to the techs, the CNAs, the techs. I used to be a tech, so they're all crucial components to the medical system. Without any of those people, our medical system would not work. You need to say something like that because it shows that you have compassion for everyone. You don't think you're above anyone, and that's what they want to hear, okay? So I don't even know why I said that, but don't say it. Number 6 is, tell me about a time when you had a challenge with a colleague. Now, this is another one. I mean, no one wants to hear that you're this confrontational person that always has a problem with other people. So I did say, you know, I never had a problem with a colleague or coworker. I get along with everyone. But if I did have a problem with a colleague or coworker, the first thing in my book would be communication skills. Asking things like, hey, what can I do to make this better? Where is it that we went wrong? You know, where is the misunderstanding? Because I can tell you one thing, when you do have a problem with a coworker, the patient care kind of dwindles, and we're in the business of patient care, patient service, customer service. So you don't ever want to put the patient in the background, and now you have this big explosive tension-filled thing with your coworker. You want to eliminate it, and I'm gonna tell you right now, don't take stuff personal. People have all types of things going on in their personal life, so they come to work with these different attitudes and things like that. Don't take it personal, girl. Don't take it personal. You know, guy, whoever's watching this, don't take it personal, because don't, all right? Always try to just be a strong communicator, and resolve, de-escalate, communicate, and you want to let the interviewer know that you're not getting into it with anybody. And as a matter of fact, you never get into it with anybody. You love everyone. You love people. Like, I love all my coworkers. That's it. Number 7. Tell me about the last time you were coached, and what was it about, and what did you learn? And I was still stuck here too. Even though I told her, I said there were many times I was coached, especially during nursing school. I mean, everything from keep going, you got this, be confident. There were times where I worked as a medical assistant and as a tech, and they're like, confidence is everything. You need confidence. Patients will feel your fear. They'll feel your nervousness. So just be confident. And I just told her that it taught me resilience. It taught me to never give up. it taught me perseverance. And she said, well, how, you know, what did it teach you, and how can you apply it to your nursing career? And I just said, you know, it taught me to keep pushing when things get difficult. It taught me to ask for help when needed. Don't be so overly confident that you can't even ask for help even though you know you need help. Or be confident enough to know you need help. Some people are so confident that they're like, I don't need help with anything. Meanwhile, they're doing it the incorrect way, you know? So just be humble, be confident, but be humble. Enough to know when to do it yourself. No one wants the nurse that's like, oh, help, 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 help. You know, no. Be confident and be confident. Okay, that's it. And be humble. Sit down. Be humble. Okay, no. But all right, number 8. She asked me why med surg. So it was a nurse residency for basically a med surg position, and I said, listen, I'm a new nurse. I need some skills, and I do have a specific specialty that I'm drawn to, which is mental health, but I've been thinking a lot over the last couple of days, and I really need a strong foundation in medicine, because even mental health patients, they have medical conditions and then they have the psych conditions. So if I don't have a strong hand, and this is a point the interviewer made as well, the nurse interviewer made, she's like, if you don't have a strong hand in medicine, now you're gonna spend double time at night reading about medicine and reading about the mental condition. So I basically said a med-surg foundation will definitely give me, as a new nurse, a solid. There's a variety of different medical conditions that I'll learn about, everything from heart disease, diabetes, amputations, different meds, cancer. It's just an opportunity to learn a lot. So that question was pretty easy to answer. Med-surg is a known position that a lot of new nurses will go to or gravitate toward. And now I kind of see why. Even before I'm in the position myself, I see why that it's important to have those strong clinical skills to be the best nurse that you can be in any field that you go in. So just think about that if you are applying to jobs, or if you have your mindset on a specific residence, a specialty. Keep in mind that a med-surg position can give you a solid foundation across every specialty, and that's something I had to think about myself. So number 9. What are your thoughts about going to a COVID unit? We are in the times of COVID. I actually had all my interviews online. So, you know, I told her I don't mind. I said, as long as there are safety procedures in place, as long as I have the right personal protective equipment, I do not mind. Because we come first, you come first, your safety comes first. And just because this is a job and this is something you really want, don't let them think that you're fine with working without a mask or something like that, because that puts your life at risk. That puts the people you live with life at risk, the people you interact with life at risk. So, you know, sometimes you got to keep it straight. Like, as long as I have the right equipment, I'm there. And she said, of course, you know, that's not something you would need to worry about. And I was like, great. Number 10, last but not least, they gave me a situational question about cellulitis. So she said, a patient is admitted for cellulitis of the leg. What would be the plan of care for the nurse in terms of physician orders and autonomously as a new nurse? Can you help the patient stay safe? So recalling information about cellulitis, I know it's an infection of the leg, you know, I know it gets really hot and swollen. So I said, you know, monitoring the leg will be first and foremost, making sure that the infection does not increase or making sure the infection is not exacerbated. Practicing asepsis, making sure the patient received their antibiotics. Like, if the doctor orders antibiotics, that'd be one of the first things I do. Making sure the doctor if the doctor ordered hydration fluids, these patients tend to be dehydrated, you know, making sure they get their fluids. And I said, you know, as a nurse, how would I keep the patient safe? I said through strong communication, you know, just being clear with the patient, asking the patient, what can I do to make you more comfortable, you know, and what can I do, what do you need, because that way I can be a patient advocate. There's that word again. You always should be a nurse that wants to advocate for your patients, but you want to let them know rather that you are going to put your patient first. So if you're a strong communicator and you can say, okay, well, what do you need? Now you can let the physician or whoever else know what that patient needs. I also said, you know, I probably put them on fall precautions because I know the leg will be swollen and red and things like that. I'll keep the call light by them, tell them to press the call light if they need anything, things like that. And just continue to be a patient advocate, keep the leg elevated. You know, I kind of forgot the disease process like completely, but I knew a little bit to like pull those things out. So they did give a situational questions, so you might want to just go back and like look at some of the nursing plans. This is what they asked me on my very first interview, and I got a call a few days later and they said, we want to offer you a position on the oncology and ortho unit. So I am so excited to start this position. Like I said, you know, initially I was thinking more about a specialty, but I really feel like this is where I need to start to get those skills up, to get all the learning I can. I'm really ready to be in the books, to learn about these different medical conditions so that I can be the best nurse. You know, so I am excited for this position and I'm so glad that I got a job. So I'll definitely keep you guys updated on how that position goes. I start next month, and I definitely will be posting videos on my role there on that unit and what that unit is like, and I hope that you guys will follow me on this journey. Thank you for watching my video. If you feel like this helped prepare you for your first nursing interview, please remember to like, share, and subscribe, and hit the notification bell so you can see when I post more videos like this one. And just remember that you can do anything you set your mind on. You are confident, you are beautiful, you are radiant, you are light, and you are living. Thank you guys so much.